Okay. Okay, a very good morning to everyone. Okay, a very good morning to everyone. Let's check how many people are there with us. Okay, we'll wait for 2 3 more minutes and we'll start our session. Okay, a very good morning to all. Welcome you all. Okay. Okay, so we will be starting our session. Once again, a very good morning to all the students who have joined our YouTube channel SGVU e-learning physiotherapy department. Here in this our YouTube channel, we share all the various topics, videos, informative videos which would be helpful for you throughout your this journey of physiotherapy course which you are doing and which you have enrolled here. So, I myself, first of all, I'll introduce myself to you all that I am Dr. Sodam Verma, heading the Department of Physiotherapy in Suresh Ganvihar University. So, welcome you all to this wonderful university and this wonderful course which you have enrolled here. And definitely, you will enjoy this course, and it is a very noble professional course which you will see after the study, after coming in the university and after teaching up your sessions, you would be looking at what kind of course we are doing and what would be our aim of our life. So I hope you all are able to visualize my PPT. Okay. Okay. I hope my screen is visible to you all. Okay. Okay. So here first session for you, that is today day 1 in this orientation, or you can say a bridge course. This bridge course we have created or designed for you all students in such a manner that after coming here in the university you will get a basic idea of the course, what is the course of physiotherapy, which in which you have taken the admission, and what would be the future perspective, and the basic introduction, and basic things you should know about physiotherapy, and the thing which you have to keep in mind, that what is it. So welcome you all in the School of Healthcare Bachelor of Physiotherapy course, and today my session would be an introduction to physiotherapy education in and around the world. So in this whole session I would be telling you about that what is physiotherapy, who is a physiotherapist, what education we give to our physiotherapy students here in India, as well as what are the various terminologies which are used to define a physiotherapist in and around the whole world. It is not only that in India there is a scope of physiotherapy, but as well as or at a global stage also, global level also, you are definitely eligible to work in every or in any of the country around the globe. So first thing that you have already taken admission in BPT course. So after this doing course, you would become a physiotherapist. That is physiotherapist. It is made up of two words, physio and therapist. Physio is a type of service that we are giving to a person, and therapist is a kind of person who is giving a therapy to a patient. So here, if we together join these two terms, that will form a physical therapist who would provide various services which develop, maintain, and restore people's maximum movement. You all know that our body is made up of different joints, bone structures, muscles, different systems in our brain, and all together, when they work together, a human being is in a working state. If a person is unable to move his body, he is unable to do any function, or he is unable to do any activity, then at that level a physiotherapist can help him. If a movement is being lost, or if a movement is being reduced, his range of motion is reduced, at that level also a physiotherapist can work on. Now, he can help the people at any stage of life. So, it is a good point of view, a good positive aspect for you, that you would not only see the patient of physiotherapy patients of on, you in the old age only. The physiotherapy is required in each and every stage of life. That means either the child, either you there is a child or a neonate, or when he becomes a school going teenager, then when he becomes an adult, or he becomes an old age, or you can say in a geriatric stage, or in a mid of the life in females, like during pregnancy, pre-pregnancy, post-pregnancy, in all the various stages of life, you would be able to see the patients and give your services to the people. So there we can help people at all the stages of life when movement and function are threatened by aging. Aging means when the people are getting older. Injury, it can be any sports injury or any household injury, or even injury, you can say a ligament injury or meniscal injury. Disorders of various neurological, cardiorespiratory, medicinal disorders, conditions you are seeing in various day-to-day life, and even environmental factors. So all together a physiotherapist is working with the patient field, with the patient, with the society, and as well as together with the whole nation. If I talk about the global level, okay, the physiotherapy, the word is being used differently in various areas. Like if I talk about in Canada, and Canada, or either in and around in various countries of the world, both the terms physiotherapy and physical therapy, both these terms are being used interchangeably. Somewhere people would be using physiotherapy, or some, but some in some places they would be using a word called physical therapy. So you can either be named as physical therapist, or also you can be called as physiotherapist. So in India, mostly physiotherapist word is being used. Either in Ireland also physical therapy is more used as compared to physiotherapy. So physiotherapy, here in this profession, we treat the various diseases or injury by various physical methods such as massage, heating treatments, exercises, and instead of using medications or surgery. So, physiotherapy, as in the starting also I told you, we are giving therapy to the patient, we are giving treatment to the patient, but the treatment would be in the form of either electrical machineries, electrical modalities we are using to give them a relieving factor or to making them relax, as well as we are using different techniques of like mobilization, manual therapies, massage techniques, and even sometimes we use few medications also along with our treatment of electrotherapy for giving more relief or giving the you can say the repairing process of the body or the inflammatory phase which comes in the starting, the healing process of the body becomes more and more faster. So physiotherapy, it helps the patient restore the body movement and function, which allows them improving their quality of life. Now, for example, if you get an injury in your hand, either by lifting any heavy object or you get injured in your hand while doing a gymming or holding a dumbbell, at that time, a physiotherapist can help you in a best manner to avoid further injury as well as to prevent the injury to become more worse. Now, what exactly a physiotherapist do? Here, a physiotherapist, what we talked about, we were talking that physiotherapy, the physiotherapist uses which techniques for giving treatment to the patient. Along with the treatment part, using any electrical machineries, either using any manual techniques, we also check the patient first. Whenever we go to a doctor, we tell, we as a patient tells all the problems to the doctor. Then from the doctor side, he gives you a various investigation. But for a physiotherapist or for a physio like us, we assess the patient. First of all, we don't prescribe him various investigation. We will assess. Our assessment is different from other medical professional. So we assess the patient properly with various special tests which we perform, which we learn in the entire journey of our study of bachelor, and that knowledge we apply at that time. After the assessment part, we come to a conclusion that what is the exact problem to the patient, and according to that problem and the environmental factors, combining with them, then we talk about that what the treatment protocol will be there for a patient. So either it can be like in this example, we are given a wide range of medical conditions like sprain, ankle sprains, or stroke. Stroke is a medical term which we call in a layman language, we call it as paralysis, and in medical term, we call it as stroke. So physiotherapist sees various wide range of patients, not only particularly to a pain like joint pain or knee pain, osteoarthritis. No, not only strict or not only confined to these areas only. In the further part, we will also be able to know that in what various areas a physiotherapist can work. So by doing assessing, by managing the treatment and planning the treatment, what has to be given, our main goal for a physiotherapist would be to relieve a physical pain, help him to heal injuries. The injury which a patient is having, it will, the exercises or various machines, it will help them to heal it. Heal means to come back into previous stage. Then also it will increase the mobility of the joint, build the strength of the muscles, because in various injuries our muscles get, when injured, their strength or their power gets low. So we have to improve their strength, even balance is affected, and we have to enhance, we have to improve our cardiovascular performance as well, because whenever we do a exercise, we know that our we have difficulty in breathing if our stamina is not good. So along with the exercises, we also work on the patient cardiovascular performance as well. So here this picture is showing you about how physiotherapy is improving the mobility and motion, and on the another side, in the red arrow part, you are telling about the patient that it will avoid you are making the patient away from the surgery or from taking drugs. So on the left hand side, if you see improve mobility and motion, a physical therapist or a physical activity will make the patient prevent his various conditions like diabetes and obesity, heart attack and stroke, then fall related injuries, cancers, osteoporosis, depression, and emotional stress. Whereas, on the other hand, physiotherapy, when we give a patient physiotherapy, by giving physiotherapy, we are making patient away, or we are avoiding the patient to go for a surgery or any prescription of drugs, which are mostly shortcuts to a treatment and to a diagnosis. But oftenly when a patient takes physiotherapy, the surgery and medications mostly are being avoided if they are go for a regular practice of doing exercises. So it can be in various conditions like low back pain, knee osteoarthritis, degenerative disc disease, and many more. So this is a diagram which is showing you that physiotherapy, after doing or when you are coming in this field, what are the various options for you, or what kind of various patients you will see. So like in physiotherapy industry, first of all you can see the patients who are working in a cardiopulmonary, who are having diseases of cardiopulmonary, like in the field, like during the COVID phase, when all the people were getting corona and they were facing difficulty in breathing, and their SpO2 level was also going down. So at that time, physiotherapy was very playing a very good role in those patients. Then the second can be in the field of orthopedics, when when you see various road traffic accidents or patient get an X-ray, fractures, and after fracture healing, the patient are not able to move their hand or their affected part. The range is come low, and even along it in the orthopedic conditions of congenital part and orthopedic surgeries, pre-surgery and post-surgery, or at that time also physiotherapy is being required. Then another can be in the field of neurology, like strokes, paralysis conditions, Parkinson's condition. Then in the field of pediatrics, in the all the children who are having the issue of, you can say, balance, autism, and their muscle strength is weak, polio patients, cerebral palsy patients, all comes in this pediatric group. Then community based rehabilitation, you go for an awareness campaign by physiotherapy, which is teaching you the various cause and cons of different lifestyles. And lastly but not the least, the sports. You already know that either it is a national state level team of any sport, or either it is an international national. In all the sports of, there is a necessity of a physiotherapist in the sports team, either it is a female team or it is a male team. So sports physiotherapy is a very emerging field coming up nowadays, and you must have seen various matches like IPL or Olympics. There also the patients are getting the physiotherapy treatment. Now after this, as we are talking about on a global aspect as well, so here along with that, in India, after 4 years, which you are doing this course in India, the after the 4 year course, there is a compulsory 6 months internship. So here a clinical education is component of entry to practice, as during this 4 year degree course, you would be able to grasp the knowledge of all the theoretical and the practical aspect. Then at after that, you will be getting a 6 months internship which you have to do. So as you all are in India, so you have to do a voluntarily, you can say, rotatory compulsory internship at the end of this course, in which you would be able to see all the patients on your own or even under the guidance of a senior physiotherapist, or he or she will be telling you about how to treat a patient and what would be the more, you can say, positive aspect, or what would be the growth of a patient, of his treatment protocol, or either you have to change or not. Now, this slide is showing you various weapons of a physiotherapist. That means physiotherapist, what techniques most commonly we use to treat a patient. Firstly is educating the patient. This comes under the awareness campaigns or various camps which we do for a society and patients. We educate the people to make themselves healthy, to make themselves healthy in the form of to avoid the incorrect postures. Then therapeutic exercises we give. We don't give exercises on a regular, like if we compare yoga and physiotherapy, yoga is a complete different process, physiotherapy is different. No doubt exercises and postures, they come in both the things, but yoga is for all well-being. But physiotherapy, the exercises which we teach in physiotherapy, those are your therapeutic exercises. Therapeutic means the exercises which we are focusing according to the treatment or according to the problem of the patient. We re-educate the muscles, because in cases like paralysis, the muscles, they forget their work, what has to be done. So we re-educate those muscles. We give joint manipulation and mobilizations. We give breathing exercises. We give various soft tissue manipulations, and hydrotherapy is being used. Various modalities, different kinds of currents are being used for treating the patients, and many more. In this slide, very few of the things are written, but when you come and study this course, you would be getting to know more and more the deeper part of it. So if you have any query regarding it, you may type in the chat box, else we would be having another session. Okay, so thank you so much for the patient listening. And if you have any query, you may write in the chat box or you may write in the comment section below, and we will definitely try and answer your all the queries. So the second part of today's session would be taken by Dr. Vidhi Gupta, and she'll give her introduction and take the further session. Thank you so much. Okay, Dr. Vidhi, are you there?
Hello, am I audible?
Yes, ma'am.
Yes, ma'am. Okay. Good morning, students, and welcome to our Suresh Yanvihar University. And I'm really glad to welcome you all today. And I hope you must have understood each and every word as Sonam ma'am has already explained what physiotherapy is. My topic today is to tell you what its role in our society, what physiotherapists can do to help our society. So I'll start with the one example, and I won't take much time of yours, and I'll explain what is the role of physiotherapy through an example. It was around in 2018 or 19 where one of my patient, he had met with an accident and he was all paralyzed below the pelvic region, below the his legs were not working. He was on bed and he has gone through all the medical procedures. He has taken all the medications and everything, and he was still on bed because he wasn't able to move. So he came to the hospital, and for around a month and a half, he was there in the hospital just for physiotherapy. And the miraculous work of physiotherapy is this, like that person now he's able to walk, he's able to do every work of his own. And within a month and a half, he just came from that bed to the walking stage. And that's how physiotherapy works, and that is the role of physiotherapy in our society. So, this is what physiotherapy helps us to do. A physiotherapist helps you get the better quality of life. To get treated with medications, get treated with surgery, definitely it helps us. But to again gain back the quality of life, to again gain back the functional independence, that is what physiotherapy helps us with. So, physiotherapist role in society is to bring back the best quality of living in individual. Best quality of living means a person living with no pain, no surgeries, no ailments, no medical conditions, and the person who is living his life not on the basis of medication but through surgery, but through exercises and physical movements, which helps to generate strength not only in their muscles but the internal organs like heart and lungs as well, to live their life in a very productive and in a very a best quality way. So physiotherapists can work in different streams like orthopedic, neurology, psychosomatic disorders, cardiac disorders, and I'll explain that to you. A physiotherapist can work in an orthopedic field. What does orthopedic means? A physiotherapist can deal with injuries related to bone and joints. So one of the role of a physiotherapist can be in treating patients who have gone through fractures or have osteoarthritis. As you all have heard it in layman language, we say gathia, right? And we all have heard that. So physiotherapist can help in all these conditions, like as I said, fractures and bone injuries, and bone condition like osteoporosis, osteoarthritis, and all these conditions. A physiotherapist can also work in neurological fields. So what comes in neurological fields? Neuro, you can relate it with nerves. So any situation, any condition where the patient and their brain or their nervous system is not functioning, there a physiotherapist can be a miraculous worker, as a physiotherapist can make you stand from where you were on bed rest, and that physiotherapist can make you stand and do their own work. So, in cases of paralysis, in cases, as ma'am explained, in a medical term, we used to say it's stroke. In layman language, we say paralysis, or in Hindi, we say lakwa, right? So, in cases where our body is not functioning, a physiotherapist is the one who can bring back the patient's to their original state or their previous state, or at least they may help them in maintaining their functional independence, like they are not dependent on anybody. A physiotherapist can help a patient to maintain that, to maintain its own independence, to help them work independently rather than being dependent on their family members or the caregivers. So which is a very big and great deal for a person who has been suffering from such a condition where he cannot do his own work, and a physiotherapist can help in that situation by making sure that the person or the patient is at least able to perform his own livelihoods, right? As we move on further, we have some pediatric condition. A physiotherapist can work with pediatric conditions. So what pediatric conditions? Like, you have seen so many children who have been suffering from cerebral palsy, right? In that case, either the person won't be able to stand properly, either the person will won't be able to walk properly, or he won't be able to speak, or these particular issues children face, and these issues can only and only be dealt by a physiotherapist, and physiotherapist can help that child to grow and develop his or her bones and muscle, and strengthen that a person to develop into a great personalities. One of our very known person, one of our very known person, and he is been suffering from cerebral palsy, and has started the treatment from the early ages, like from 4 to 5 years only, and is now the most motivational speaker, you might know. He is been doing so great, but just because he's exercising daily, working daily for his own livelihoods, for his own strength, and that's how physiotherapy helps. Physiotherapy helps in creating that particular atmosphere, particular environment for that person to help himself to grow and develop. So the role of physiotherapist in particularly in pediatric patients have been very thrilling as well as very adventurous also, as you need to work a lot to bring that child to grow into a big person and with full development and growth. Physiotherapy can also be used in cases like geriatric patients. Now, what is geriatric patient? Geriatric are those patients who they are working in case for the old people, right? For the old people. So geriatric patient, old age, our muscles go into weakness, our bones go into weakness, our organs go into weakness. So physiotherapist helps these geriatric population in gaining back their strength, and helps them to live a longer life with good quality. Just living long is not important. Living a good quality of life is important, right? So they helps you out in living long as well as a good quality of life. You can also work in the field of sports, and sports itself is a very vast field, and right now it is the area where physiotherapists are more towards. It's like in this field there are many teams, like we have cricket team, we have football teams, we have Olympic players, we have wrestling, we have javelin throw, we have shot put, we have so many different games, and all these different games causes different kind of injuries to the players, to the athletes, and these injuries and these ailments can only be dealt by a physiotherapist. So physiotherapist always helps, not only on field but off field as well, to help the athlete and to help the player to win those medals and trophies that we are so proud of, right? So as a physiotherapist, you work on the back end of that player to provide them that strength and to help them heal that injuries they have gone through during all the practices and during all the hard work they are doing for a particular sport. So physiotherapist helps a lot in sports physiotherapy. Physiotherapist also helps us in some cardiopulmonary conditions. What is cardiopulmonary? Now, cardio is very, easily understood. Cardio relates with our heart, and pulmonary relates with our lungs. So during this COVID and this COVID-19 phase, all the physiotherapists were working not only in the ICUs for the patient, but after that, the side effects of this COVID condition led to people having many breathing problems, breathlessness, shortness of breath, and all. And who were working for them? The physiotherapist. Now, physiotherapist helps us. Physiotherapy is the field in respiratory where they will help in strengthening our internal organs as well. They will help us in better breathing. They will help us in better cardio, yani better heart. Uh, it will help you in better heart functioning, better respiratory functioning, and that's what physiotherapist worked throughout this COVID duration of 2 years, where a physiotherapist was not only working in the ICUs, but they were also working in the back end where they used to treat patients after COVID, so that they could treat the post COVID symptoms. And as well as physiotherapists also work in ICUs, as I was saying, in the intensive care unit, where they help in maintaining the patient's condition. In ICU, you cannot ask the patient to do exercises, but there are so many different techniques and so many different, modalities that are used in the ICUs, which help in maintaining and helping the patient to survive a particular condition, right? And that maintenance and helping in the survival of the patient, and physiotherapist also plays a very big role. So in overall, a role of physiotherapist in this society as a medical professional is to treat conditions, is to treat pain, and to provide a better quality of life. This better quality of life is important, as you know, after a surgery or medicines, you are living your life. But if you're living your life with pain, if you're living your life with disabilities, if you're living your life with discomfort, that life is not any use. So physiotherapist helps in treating all those pains, all those disabilities, all those discomforts, all those ailments. Physiotherapy is a unique treatment, and it promotes good quality of health. So, what a physiotherapist can help you? It can help you in having no more pain. It can even prevent so many surgeries. There are many situations where a person continues their exercise and the surgeries are delayed and delayed, and you don't even require surgery anymore. So, physiotherapist can help you in that. So, and physiotherapists can help you in managing women's health, which is a very upcoming stream of a physiotherapist, where in women's health, physiotherapist, works with pregnant ladies in obstetrics, that are the pregnant ladies, where they help in preconception exercises, and that means pre-pregnancy exercises we can go through during pregnancy exercises and post-pregnancy exercises, where you can create a beautiful atmosphere for the baby and the mother, and prevent many complications that could follow after pregnancy. As well as it could also work with gynecological women health, like many women nowadays are facing PCODs and PCOS and dysmenorias, and that means the pain during the menstruation time. A physiotherapist can help in rendering all those pains and creating that whole phase pain free for the women who are going through. So, overall, physiotherapy can help in every disease, every disability, every discomfort, and can help you in creating fitness, a healthy lifestyle, and a good quality. So, I believe you guys are very lucky to be pursuing this career. As further myself, I feel ki every society needs a physiotherapist in it to provide best fitness and best strength in the people, and to remedify all the ailments without the need of any surgeries or medication. And that's what physiotherapy is all about. I hope you all understood the role of physiotherapy, how big our responsibility is to treat patients and to provide them with the best quality of treatment and health. That's all from my side.
Okay, thank you so much, Dr. Vidhi, and thank you all the students for being the part of this session. I hope you are able to get an idea about this whole course of Bachelor of Physiotherapy and what would you be able to see, what you will be able to learn, and even after that, what you would be able to pursue after this course. So, thank you so much, everyone, for joining this live streaming, day one of the bridge course of physiotherapy BPT course. And tomorrow, the same time, we'll catch you, and same time, same place on this YouTube channel. And bye bye. See you for today, and tomorrow we'll be meeting at the same time with the new topic for you all guys. And thank you so much.
Thank you.